Welcome to The Patient Physician, a space for doctors to explore their physical, mental, and financial wellness. Your peers and industry leaders will destigmatize institutional perceptions while redefining success, money, and personal care. Get ready to pull back the curtain because here, you are both patient and physician.
Welcome to The Patient Physician. I'm Paul Smith, and I'm here today with my co-host, Chris Fulbright. We're broadcasting live from the 2024 ACGME conference in Orlando, Florida. Good afternoon, sir.
Hello, buddy. What a great event it has been. What, 4,000? Is that what it is? 4,300?
I actually lost count. It has been...
You've been counting people?
Well,
Yeah.
I thought we were supposed to.
Yeah.
Today, we are joined by Dr. Kathryn Hughes. Kate, great to have you. She is a pulmonary critical care fellow out in San Diego with the Navy. And we had a wonderful opportunity to sit and enjoy your presentation just a little bit ago. You got to talk about leading from the middle, which I think is an incredible topic to speak to. But before we get into all of that, if you'll just take a few minutes and share with us a little bit about you, how you got here, and whether you're regretting at this point agreeing to this podcast.
Absolutely. Well, thank you for that. So I'm Kate Hughes. Like you said, I'm a first-year pulmonary critical care fellow out in San Diego. And I was an internal medicine resident, obviously, and then I was a medicine chief resident, which that was really the phase of my life where I got particularly interested in this topic. And so I was really lucky to have as my program director and associate program director during my chief year, Dr. Nancy Miller and Dr. Alexis McBee, who I just did this presentation with. They scooped me up into this talk and said, hey, I think that this is a topic that you're going to find to be very relevant to your year as a chief resident, which wow. I sure did. And then they really taught me a ton. Really, it was a mentorship opportunity. So we gave this talk last year at this conference, and the preparation for that talk was such a mentorship opportunity for me to really learn a framework for trying to make things better from the middle of your organization. And I think as a resident and as a chief resident and as a fellow, trying to make a difference can be so challenging. And I think often, especially as a trainee, you just feel like you're hitting roadblocks all the time. And so having a framework to fall back on and then to be able to teach was such an eye-opening experience for me to feel like, well, there are like legitimate tools in my toolbox that I can use that are probably going to be a little bit more effective.
Mm-hmm. Yeah. That's great. So your talk was phenomenal. And Paul and I took a bunch of notes where you're in a room of 1,500 people or something of that nature. One of the things I found fascinating is your framework of four things, starting with understanding the needs of the organization. Can you touch on those four and we kind of maybe dive deeper into those?
Yeah, absolutely. So we feel strongly that as physicians, we love frameworks, right? We talked about how, as you're teaching medical students, the easiest way to teach the differential for chest pain is to have a framework. The best way to teach how to manage problems as a resident or triage problems as a resident is to use a framework. And so this is something that I think is very familiar to all of us as physicians. And really, having it in very discrete steps makes it just that much easier to remember and implement moving forward. So the 4 steps that we talk about, the first one is understanding the needs of your organization. And I think particularly as a resident, this was the step I did not understand at all and really had no intent on understanding, because taking that extra step, I think it requires an emotional capacity to understand, okay, what I'm seeing and feeling day to day as a resident is exhausting and it's really challenging, but it's not the whole picture of this organization. And taking the time to find out, asking your leaders specifically, I'm really passionate about this part of, it is as simple as asking your program director, hey, what's your mission for our program? What are your priorities right now? And where do you see this program going in the future? Because a good leader should be able to say that immediately, right? They should be able to articulate for you, what's my kind of long-term game for this program? And it's going to prevent roadblocks in the future, right? And understanding kind of what are the opportunities available to me right now in this organization.
If I can jump in right there, understanding, taking that first step, understanding the needs of your organization. The reason why I find that fascinating that you stop there is because as a trainee, a resident, your time is pretty much limited unless I'm going to go on and my dream is to stay on as faculty, be part of this organization. You're on a clock. So to actually care enough, you have to start there to understand the needs of an organization. What that first step is really important, and you do make things better. So did that click for you at one point to say, hey, I actually care, even though I may not be here forever? And so...
Yeah, I think, to be totally honest, and maybe I wish this answer was a little bit different, but I don't think I really cared as a resident, because I did feel like that sort of, my time is limited. I want to make my immediate circle better. And why would I take that extra step to understand the whole hospital or to understand kind of the even larger system at play? And then I became a chief resident, and I saw time after time residents having great ideas that went nowhere. And that was super frustrating as a leader, to feel like, I don't even understand why their ideas aren't going forward. I don't understand why we're having to put them in these positions, or, why we're not able to give them every resource that they're asking for. That seems like a good idea. And so in that kind of perfect middle manager role, having that opportunity, as a chief resident, you have access to all of these people, which is kind of the fun thing about the role, is you really get to know all of these people in different kind of positional authority, and to ask them, like, wait, what am I missing? What are the opportunities right now? What are the big problems? And I learned so much in that first 6 months of my chief year, of just by asking questions of, hey, I guess I don't understand, where does this funding come from? Like, what are kind of the hospital level opportunities for, getting better food options for overnight call, or those kinds of things. And it just was because as a resident, I wasn't asking the questions. And some of that's because I didn't have time. But I think some of those ideas probably would have been more successful earlier on if I had taken that time to ask.
Yeah. It speaks to like engagement. We heard that from another talk yesterday about how do I get more engagement. Now that was a different group that they were talking to, but how do I get my residents to be more engaged to then actually care? So there's actually still some steps before understanding your organization's, what they're trying to do to, get them engaged. And then the second part of that is, can I make a difference? Like, I don't have time. Why should I care? And then if my time's limited, will anything even change? Right?
Totally. Yeah, and I think that it's a subtle but a really important frame shift, especially when talking to trainees of, can I even make a difference? Like, why would I spend all this time and energy on this QI project that I don't think is going to change anything in 5 years? And I think trying to flip it into, the way that you feel valued and feel as though your work is meaningful is if you are engaged in the conversation, you're at the table, you're having conversations with people that matter, who like make these decisions definitively, right? And you have an active voice. And even if maybe not every single idea you put forward is going through to the end, you're an active participant in the conversation. And I think you go home at the end of the day feeling, I really did something today. I was like I advocated for my residents. I raised an issue that maybe leadership hadn't heard about before. And even if I'm not going to be here in 5 years to see the definitive outcome of getting this fixed, I was an important step in that process.
Right. Yeah.
So I think that goes a really long way. And sort of like how you view your work and how you feel empowered as someone in the middle of an organization.
Yeah. And that speaks to the key topic of this whole conference is meaning in medicine. That's right. Right. And even if I'm not going to be at this organization for that long, can residents make a change?
Yeah.
Yeah. They can. It's like a ripple effect, right? Yeah. If I drop a stone here, that ripple starts here, but does it reach the end of the pond eventually?
Totally.
If you're leading from the middle right now, how do you encourage people, younger residents or even the people top and bottom, to care enough to say, hey, I can be patient enough to know that what I do today will reach the other end of the pond?
I think it can be really challenging. And I think part of that is understanding that not every resident's going to have the bandwidth for that at every point in time. And that's okay. And I think that's how it should be. And, when I would talk to residents as a chief, I would say, it's okay. You don't have to be doing, 10 steps on your QI project every week. There are going to be weeks where you don't have time for that. And that's okay. And you don't have to sign up for every committee because you don't have the bandwidth for that. I don't have the bandwidth for that. Like, that's not going to be productive. And so I think empowering and encouraging residents to find small areas that they care about, that they can help impact a small change and not kind of bite off more than they can chew, I think can be really helpful in moving that forward, of saying, not every resident's going to change the, floor plan of all of the admitting wards. No, not every resident's going to totally change the call schedule. But there are certainly things that you're passionate about that are small, that are totally changeable or influenceable.
Yeah. So you start with the understand the needs of the organization. And then the second one is aligning the vision.
Yeah.
So you start with asking the question.
Totally.
And we went through that. So talk about the vision. What is that? Why is that the next step?
Yeah. So I think once we have a sense of kind of our own personal needs assessment and then understanding the needs of the larger organization and the priorities of leaders, I think that's a good step to kind of craft what your vision is for your idea, right? Yeah. And we talk a lot at the beginning of the presentation about how important it is to have kind of realistic optimism and to have, to come to your leaders with a plan, right? And so, all of us have been in the position where we just want to go vent, right? We just want to go to our leaders and say, this is a problem and you're not taking care of it. And there is a time and place for that. I think there's certainly there are plenty of opportunities for that. But I think if you really want to be an agent of change, you have to be able to craft a plan, right? And to say, here is what I've identified as a gap. And I think you see it as a gap too, as a leader. And here's how I think we can attack this. And in order to do that, you have to have a clear vision of what that means. What exactly are you trying to do? How is this going to help the organization? What would this look like from a practical level? Logistically, what resources do I need? What's my team going to look like? And so making sure that you have a clear vision of this before you try to really communicate it to anybody else. And then, making sure that it's meeting a need. I think going back to what we've identified as our need, right? And I make this point because I think I've seen this happen before in the presentation where I say sometimes it's not obvious to other people what need this is going to meet. And so you have to make sure that you're very clear about this. I saw X need and this is why this plan is going to fix that. Yeah.
Yeah. So you talked about, and one of the wonderful things is your presentation had live feedback from the room. Mm-hmm. So y'all were adapting the whole time. You're getting names and adjectives of different things. Mm-hmm. And one of the things I took out of that part was, is my vision clearly defined and easy to understand? And is it actionable?
Yeah.
So it goes to your point. Many times we share an idea or we complain. Mm-hmm. Paul and I talked all the time to people, don't just complain, come with us an idea.
Yeah.
But is it actionable?
Right.
Here's a vision. Can we do that? And then go back to it. Does it help align with the vision of maybe people that are higher than you in the organization at that
mm-hmm.
point? Right?
Yeah.
Yeah, that's great.
And I think the other thing that was shared was that sometimes you're going to hear no, mm-hmm. and that doesn't necessarily mean stop. So I'm glad that they,
That's right.
glad that they addressed that and said, hey, well, what do you do after somebody says no? Because oftentimes we might just say, oh, I'm done. See, I couldn't make a change, right?
Yeah.
I do that. I can't make a change. I'm just going to go home and take my toys with me. But they said, wait a second, stop there. What can you do? How do you respond to no? And one of the answers was, ask why.
Yeah.
And I think that speaks to, well, wait a second. Did the person that you conveyed the information to clearly understand? Did you articulate? Are you speaking that person's language?
Totally.
And I think we have to remember, we try to do this a lot where you go, what is that person that I just talked to going through? Because I'm feeling a lot. I brought stuff into this conference. I've got things going on before we sat down. Yeah. I've got things going on after we leave. Mm-hmm. What is it that's going on with that person? Let's see if we can get them centered in on it and understand where they're coming into the conversation at.
Yeah.
Before we even go and say, hey, I want you to change everything for me today. And then make sure that they understand that we actually have done some homework.
Yeah.
And I did understand, because it does drive me nuts. And maybe this is where leadership sometimes also gets upset, as they go, you just got here and you're trying to flip everything around.
Yeah, I think that I really love that section of our talk where we talk about no, because it evokes such strong feelings in us, right? When we're told no, especially when it's like a precious idea that we've spent time and energy fostering, and it's a problem we really care about, and we don't know that leadership's listening. And, getting that no can really shut people down.
Right.
And you see this all the time, right? Somebody comes in, especially at a new job, they come in with all these great ideas, and the first thing they get told is no. And then they're like, well, then I'm out. Then this isn't the place for me. And certainly there are environments where that is true, but I think that no is such a great opportunity to just ask more questions and just understand, okay, why exactly are we saying no? Is it, you can use like a callback kind of strategy of, well, maybe can you tell me what you heard when I gave you my pitch? What did you think that I was going
Get them to put it in their own words.
Yeah.
Can you share an example of maybe when you were told no and you'd put a lot of work into something and maybe it was a little heartbreaking, or how did you recover from it?
Yeah, I mean, I think something that is near and dear to a lot of chief residents' hearts is building the resident schedule. And when I was, getting ready for my chief role, and I spent all this time, and it really is, especially, and we're like a relatively small residency program. I think we have 30 residents, but building the schedule is such an intricate puzzle, right? And I had some new ideas for here are some ways we could revamp some rotations. Here's some ways we could be creative with the call schedule. Here's a way that I can make sure that everybody gets every single one of their vacation requests, which was like something I held myself to like a lot of personal pride to this goal. And my first several drafts got kicked back as nope, these aren't going to work. Here's all the things I see wrong with this idea, et cetera, et cetera. And I took it really personally because it was sort of it's your first like role as a chief of like, I'm going to do this, I'm going to do it well. And to then get that immediate feedback of this is not up to snuff is hard to hear. And I think, now I realize that actually kind of prepared me pretty well for chief year of, you're just going to get told no. And you just, I'll talk about a little bit of some of our strategies that we would recommend employing in those situations. But two is like being willing to take a step back and say, this feels personal because this is something I care about. And it's something that I invested a lot of time and energy into. But at the end of the day, it's not about me. It's not about my emotions. It's about just trying to do the best job that's going to work for everyone in the organization. And so being willing and taking that time to step back and say, okay, why do I feel the way that I feel? Like what? Clearly this upset something in me, and I'm just going to separate myself for a second, and then I'll come back to it with some fresh eyes. But I feel really strongly that no is just an opportunity to ask some more questions. And so, like we were talking about earlier, is it just that your pitch didn't really articulate what you were going for? Or maybe you didn't correctly or adequately explain how this plan is going to meet the needs of the organization? Or is it just that your plan isn't what is needed right now? Maybe there are some tweaks that you can make, do a little bit of negotiating, meet them in the middle so that both of your goals are met, at least to some extent, or it just might not be the right time. Like we talk a lot about this idea in the presentation about kind of trying to revamp our program evaluation committee to be more of an action committee. And this, the reason we use this as a case is because this happened at our institution. And for a number of years, it just wasn't the right time. And, it finally got to the point where like, hey, this is the time where we can really build some strong action committees, some subcommittees with good ideas and fresh takes. And, eventually it was always a good plan. It just, for a while, it wasn't the right time. It wasn't the right culture at the institution. And then it was, and we were ready to go.
Yeah.
And so, recognizing that sometimes it's just not ready yet. The program or the department or the hospital isn't ready for your idea. And there are a lot of ways that you can add value in the interim, right? And build trust in your leadership that, hey, I am an engaged member of this hospital. I care about this program. I'm willing to help in areas that may not be my little passion project, but I am here to help and I'm here to support the mission. And that buys so much trust for you moving forward in terms of getting buy-in from your leaders for things you want to do in the future.
I find it interesting. Your talk of leading from the middle. We think top down, bottom up, but from the middle, sharing ideas, you call it a pitch. You started with asking why. How does this align? And then if it doesn't go well, you ask why again. And then if it didn't go there, okay, what did I do wrong? So it's interesting to me that your leadership from the middle is you sharing, which would be proactive and trying to make things better. But each step of the way, you're going back and asking a question of others to make sure you're understanding it properly.
Yeah.
Or of yourself.
Yeah.
Which kind of goes to the communicate effectively, right?
Totally.
Your next step of like, am I communicating this? Am I answering something that's really of a need?
Right.
Which a lot of people, I think, want to just share an idea. But what I have seen is being in different roles and different levels in corporate America and businesses is that sometimes that role that someone was in, as you just described, you're not accustomed to that role caring about other avenues.
Yeah.
They're kind of focused on that career path, whereas Paul started with, hey, you're only here for this period of time. You're here for this season of your life. I'm really not going to worry about it. I'm just going to get my job done. What's my next task? I'm going to move on.
Yeah.
But what you're advocating, it sounds like to me, is, hey, if there's a place you can improve it, share that idea. And if you get told no to a rejection, which is hard, ask why.
Yeah.
Which is so powerful. Like, there's vulnerability in that as well.
Totally.
Yeah.
Totally. And I remember so many moments as during my chief year of sitting at the new and improved PEC, right? And bringing an idea and, a small, here's a little way we could tweak this. Here's something that we could tweak this. And it's so easy. The first pushback you get, the first devil's advocate that steps up to the table, right? You're like, oh, this is a dumb idea. This is super dumb. I didn't spend any time on it at all. I'm just going to forget it ever happened.
Yeah.
Is that productive for anybody, right? Everyone asks questions in different ways, right? So sometimes you just have to be willing to say, I'm just going to rephrase what I said. And I'm just going to make sure the room heard what I was trying to say so that I can know for sure that I gave that pitch that I was hoping to make.
Yeah. Yeah.
As I was listening to you ask that question, frame it up, Chris, I was thinking about how your role right now and being in the middle. And this is why I love talking to you about this, because it's probably the most impactful place to be in an organization. And yet the framing of it mentally is you think I'm probably in one of the weakest, maybe the people below, maybe you think, well, I don't really, I'm not even going to be here.
Sure.
But then you think, I can't really do anything in the middle. Whereas if you spend time thinking about it, why is that the most powerful position? Because at the top, they often can't say yes or say no because they only have a limited amount of information to make that decision. What are you presenting me? Do I have enough information to make the decision? Because they have all these other things going on.
Totally.
I don't have enough information to make that decision. I got to move on to this next thing.
Yeah.
But they also don't know what's going on down below. So you in the middle have the information from up top, what the leadership really needs and wants, and the people down below who are complaining. So even though you're being compressed in the middle, you have the most information to affect change and kind of navigate that. So when you find out leadership in your talk, it says leadership is a process whereby an individual influences a group of people to achieve a common goal. This influences, I don't love the word influencer, but this is really what you are in that organization, to influence. You're massaging, both places above and below to just help them come together.
Absolutely. And one of the things that I love about our program evaluation committee right now is that we elected resident representatives from each class. And, I think it would be easy for that role to just be a kind of a box check and it's a good CV bullet, whatever. But I felt really strongly when we were, having the residents elect these people, that this was an extraordinarily powerful role for them to be in. One, they're the voice for their whole class, right? And so they are providing this group of decision makers with so much information of things that, we don't see, right? On day to day of what's the workflow of the hospital like, what's the culture of the residency program, what are the issues that we haven't heard about? And then they're getting a seat at the table, right? And they're getting to hear the reasoning why, and they're getting to understand, okay, maybe I didn't know what the needs of the organization was. And maybe now I have more information to take back to my co-residents to explain, hey, here's the reason why maybe this idea isn't, going to work right now, but maybe it'll work next year, or maybe it'll work, at somewhere down the line. And so that role, I think, is hugely influential of being a spokesperson for your co-residents, and then being able to kind of help people understand, here's what's kind of going on.
I love the fact that you keep coming back to timing, because it depersonalizes a decision, because a lot of times it's not about us.
Right.
Although we want to make it that way.
The idea you're sharing is it the right time for the organization?
That's right. It's not no, it's just not now.
Correct.
And so that can help me come back and go, okay, well, what could we do now?
Yeah.
And then if not, just keep coming back with ideas and keep trying to make things better, but just try to depersonalize that so I still stay involved.
Yeah, exactly. And I think that's a good maybe segue into our third core point, which is communication, which obviously you could incorporate communication into any one of these steps, right? But I think having it as sort of a consolidated step in your process of, can I articulate exactly what I want to do and why I think it matters in a way that is going to leave no question of, here's my plan, here's why I want to do it, here's who I need on my team, here's what that's going to look like, is so, so, so important. Obviously, one, because you want the people that you're talking to know that you know what you're talking about. And you want them to know, like, okay, if I say yes, then she can get this done.
Yeah.
Like, she's thought this through to the practical level.
Yeah.
Which is, easier said than done for sure. But then the other thing it does is it builds that trust that we've talked about, that I've taken the time to think about the larger organization and think about where I fall in that organization and what those needs are. And that, I think, goes a long way in terms of this current project I want to undertake. And then when I bring more suggestions to the table, it's within the context of my leadership knowing that I have taken the time to think about the larger organization and I have gathered some context beyond just my complaint that I have because of X, Y, or Z.
Yeah. You said the implementation, communicating clearly the idea, and then you have the leadership or the manager. We'll touch on that in a second because I think that's the next step. It's very important. Y'all broke that out, two different skill sets. But I think sometimes, Paul, we have people bring us ideas, and what that new idea, that change really does is put more work on us.
Yeah.
It's a fantastic idea, but we may not have the bandwidth to implement that idea because it's just additional work. Whereas what you're saying with the influence, and then one of the things y'all had on just about every slide, building a team, teamwork.
Yeah.
And then how do you step in and be able to do that? I think that removes some of the hurdle from leadership or whatever when you're going, hey, I've got a new idea. Here's how I see it. You've communicated it clearly. You've walked through it, but you didn't add additional work onto their table.
Yeah.
Right?
Yeah.
Like, how do I help make your job better? How do I make it easier?
Yeah, I think that's so important. And I think in basically any role that you're in the hospital, you'll have this opportunity to take on tasks that people bring to you. And it's very easy and natural, especially if you're a person who likes to please people. It's very easy to be like, I'll totally do that. I'll take care of that. That's a great idea. I will implement that. I'm on it. And, it only takes a few times of that happening and then you're getting really overwhelmed.
Yeah, famous last words.
Yeah, exactly. I think you have to kind of build in a mental stop for yourself to say, why don't you come back to me with a plan?
Yes.
And then talk to me about how you're going to build a team and how you're going to make this happen. And one, that's so empowering for the person that you're talking to, hopefully, if you do it well, if you manage that conversation well, to tell them, like, I'm so excited to see how you're going to implement this. I'm so excited to see how you come up with a plan and you build a team and tell me how this is going to happen.
So you're not rejecting or saying no.
Yeah, exactly.
You're saying, great idea. Come with the next.
Exactly.
Very powerful leadership language. That's great.
Yeah. I had a resident when I was a chief who came to me and said, there is nowhere for me to work out on shift, like when I'm on the wards, because it's, the hospital gym's too far away for me to feel like I'm safely taking care of patients. But there's downtime in the day, and I really want to just be able to like do some push-ups or
Well,
whatever.
you're military. You could have just told him drop and get a 50.
Exactly.
I mean, I don't understand.
I outrank you. Drop.
Drop
Yeah.
and give me
call
50.
that-
And don't talk back to me again.
We could call that a missed opportunity. But
We're just coaching. We're
I'm just-
coaching over here too.
No bad ideas.
Thank you for the feedback.
Feel free to use that.
But at first I was like, oh man, that's a problem that I should address. That's my job. It's, and then eventually I went back to this resident and I said, what if you came up with a plan? What if you came up with a plan and you wrote out a pitch and you put together a team and you came to the program evaluation committee and you told us about it? And to be honest, I wasn't sure if that would ever happen because it's a busy resident. And I was like, we'll see what happens. But if you really care about this and you think that this could be implemented, then go forth. And I look forward to hearing what you come up with. And the resident came to the next program evaluation committee. They had identified a space. They had gotten permission from whoever owns these spaces, right? And they had put together a team and had a financial plan for how they were going to fund making a resident fitness wellness room. And it got approved. And it exists now and residents love it. And it's right on the wards and so I think that was so powerful for me, to see if you give people opportunities, they'll step up and they'll make things happen. And if you just say, that's a side project that I can worry about later, chances are it's probably not going to happen to the same success that it would happen if you gave that job back to the people who are really excited about it.
Yeah.
As you're saying this is also a higher level discussion too, for the people up at the top to hear this part, not just the people below to, hey, how do I message this in the communication? It's also for those at the top to turn around and say, hey, help me, help you kind of thing, where you redirect them. Doing that, I think sometimes a lot of very good leaders get there because they said, oh, I can do that. And so they work themselves to death to the top.
Yep.
But then what ends up happening is now they have no more bandwidth to be adding any more consideration to any more ideas.
Yeah.
So when they're given that opportunity, all they can say is, I'll get to that. And then they haven't had time to consider the ideas they were presented 6 months ago. And so things just fall flat. So for the leaders above, it's important for them to be able to turn that around and say, give them an opportunity to go create that idea and come with solutions rather than just ideas.
Right. Exactly.
Well, so we've talked about communicate effectively. Let's go to the fourth part of your framework.
Yeah.
Right? Understand and how to lead manage. Can you touch on that and guide us through that?
Yeah, absolutely. So we started the talk by, having people give us words that they think about, right? With leading, with managing, and those evoke very different images, right? They were very different lists of words. And leader was a lot of inspiring. It was a lot of, respect and authority and decision making,
a lot of
vision setting, and then managing.
Very emotional based, right?
Yeah, very like robust personal traits, right? Of things that we admire. And the managing, comes to mind, brings a lot of, time management, organization, administrative burden. Someone wrote boring tasks or something like that. And so they certainly evoke different images of different people, right? You envision different roles, but the reality is that there is a lot of overlap between those. And, in order to really lead, you sometimes have to manage. And certainly not everyone who's utilizing managing skills is also utilizing leadership skills. So there's some distinction there that I think is useful to parse out and kind of think about, okay, what bucket am I putting on? What hat am I putting on? But really good leaders have to be able to do both. Right. Yep. You have to be able to, set your vision and build your team and inspire them. But then you also have to delegate and manage time and get tasks done and think about things to the practical level. And so I think it's helpful when you're sitting down to take on a big project to be able to parse out like which of these skills do I need to use right now? And do I need to harness those a little bit? Do I need a mentor to help me figure out how do I set this vision or how do I inspire this team? And do I need to delegate some of these management tasks? And so I think being able to think through those systematically can be really helpful when you're setting on a daunting task.
Yeah.
Is this the type of personality that you were before you came into doing this presentation? Did you find yourself to this position organically, or was this something where some of the residents that are listening right now who fall into that, well, I'm only going to be here for a little bit and I can't affect change, that somehow or some event like invoked this emotional connectivity between you and your program and wanting to get involved? Or is this just you, every morning you get up and you're ready to take on the world?
I'm going to fix it.
Every day I think about what management skills I need to use today. Yeah. No, I think that, I certainly think my residency experience fostered a lot of this is of seeing, like I mentioned earlier, seeing people have really good ideas that don't go anywhere. I think is very inspiring to think about like, okay, what went wrong here and how could that person or how could I have approached this in a different way that might have been more productive? And then I think I had really good mentors and I have really good mentors who are able to kind of foster this a little bit. And, Dr. McBee and Dr. Miller, who I do the presentation with, are the two who really helped me understand this and who helped me start to implement this in my day-to-day life. And they were there as sort of coaches during especially my third year of residency and my chief year of saying, it's sort of like little angels on my shoulder of saying, I don't know that you had to take that task on. I think that was an opportunity where, you could have done this or you could have delegated. And they were absolutely cheerleaders as I sort of learned along this journey. And obviously I'm continuing to learn of what does influencing your organization in a positive way really look like.
I bet they're learning too, though.
I think so. And I think that's like the great thing about this talk and this subject is that we are all in the middle of our organization and, we all feel it to different levels, but the reality is we all work for somebody, right? And so we're all trying to influence up, we're trying to influence across, we're trying to influence the people that we have a supervisory role for. But we're all there to some level.
Right.
And it could be a professional setting, but it could be anywhere in life.
Absolutely.
I mean, you could be at a PTA meeting.
Yeah.
You could be coaching the kids' teams. You're talking to parents and kids. One of the dynamics, and I thought it was a great visual that y'all had, the pyramid. You're saying leading from the middle. You've got arrows going up and then coming down. And then y'all pivoted towards the end, which I thought was fascinating, across, leading across. Can you talk, and you talked about building teams. And how do you communicate differently on a peer-to-peer kind of a level versus sharing a vision of improvement up? Like, how do you do that without being offsetting, if you will, right?
Well, I think that the most important part of that is just asking questions, right? And so I think the worst thing that you can do in any sort of leadership capacity is to assume you understand what the needs are or what the gaps are and go into this conversation without an open mind, right? Of here's what's going to happen, here's what we're going to do, the plan is set. Right. That is the most off-putting thing I think you can do when you're talking to your peers, especially, and people that, might work for you.
We're going to have a meeting, but the decision's already been made.
Correct. Yeah, that was really tough.
I just want to have a meeting to share my idea with you, and we're all moving forward, rather than, Kate, share your idea with how we can do this.
Yeah.
Really, Let me tell you how we're all feeling right now.
Yeah. And so I think, I think having voices that you trust, and this is challenging because you don't have to, nor should you, I think, always listen and implement every voice that you hear, right? You have to be able to know that I'm taking thoughts from a wide swath of people, and I have a sense of kind of, this is how the group feels in general. And then being able to identify people who want to be on your team. You want to find people who are really excited about this, who are motivated to help, who are going to take the time to also try to get better themselves at this kind of middle leadership role. And so I think when you come to these conversations with questions and then you come with opportunities, that goes a long way, no matter which kind of way you're leading as peers or, let's say you're a junior faculty talking to residents, like that, I think goes a super long way and gets people feeling like they're an active member of this team.
That they're valued. Their voice matters.
Yeah, their voice matters because we're, at the end of the day, we're all here to talk about medical education, right? Like we're here to build doctors and help foster, leaders in the hospital who are really engaged in improving patient care and improving physician wellness and improving the quality of education. And so, when you bring people back to those kind of core values, they get really excited and they want to be a part of it and they want to help make things better.
When you say that, it reminds me of your leadership about crafting a vision. Yeah. Creating of it, and you're saying, hey, what you do matters. It's interesting, Paul, when you're talking about this, we've had a couple of podcasts and we've had established physicians who've been working for 35 years. We've had new people. We had a practice manager on, and she shared that one of the biggest things that she sees are these soft skills, the communication skills of exiting. Hey, I'm just going to open the door. People are going to show up. It's going to be great. Or how do you run a budget? And it's interesting as I'm listening to you talk about solving these problems. You've covered the gamut from financial to efficiency to organization to someone doing a workout. But then also you being able to say, hey, is this an idea that I want to implement or that I should implement? Or I'm really excited to see what kind of solutions you come back with. Yeah. What a great language and communication. I think this framework, these 4 pieces of framework will fit into so many different, Paul and I have talked about the visual of who we really do this for, is we envision this resident or fellow or doctor, you're getting to the hospital at 3 a.m. or 4 a.m. It's dark. You're listening to a podcast or you're in between rounds. You're taking something. I think somebody's going to hear what you say and they're going to be able to distinctly put themselves in your shoes and say, wow, I think that I can make a change here. I want to share something. But it's interesting. We start with asking questions, not with just saying, hey, here's what you should do. Here's what I think. Every time you said, ask more questions, understand the why. What's the vision? How does it fit in here? That's fantastic. Yeah. That's great.
And I think as a leader, one of the important things is identifying which are the problems that are my job to take care of and which are the things that I can sort of delegate to people. I can help empower people to take on these tasks, and figuring that out can, I think, be challenging. And that can take some emotional intelligence that I think is important to be mindful of, hey, this person who's coming to me with this problem, they're not in a place where they can systematically fix this problem, right? I need to maybe escalate this problem to somebody. Maybe it's not the problem for me to fix. Maybe it's my program director's problem, et cetera, right? There's always times where that needs to escalate. So, certainly I would never go into every conversation being like, I can't wait to figure out how to give this problem back to this person, right? Like that's not going to work.
I'm going to throw this back at you.
But when you can do it, I think it's so powerful. And I think we talk about burnout all the time. And this is, at the core of medical training right now is we're all thinking about how do we help ourselves? How do we help our colleagues? And certainly it's not the answer, but I think one way to feel really valued in your workplace is to be able to say, okay, I made this thing better. I was on this team and I had a voice and I made a positive change that I can see. And that is huge. Being engaged, I think, is one of the best anecdotes we have for burnout. And that comes from a personal place, not just like, hey, I think people need to do more for the hospitals. They're not burnt out. I found that to be true in my own life.
Yeah. So I think engagement in any capacity starts with asking them to think, basically, past the idea.
Yeah.
So I have to relate this back to my kids. I think I do that every show, basically. So I have a 12-year-old, and she and I were out in the yard working, and I, of course, have my power tools. I love
it's a
my
necessity.
lawn tools.
Yeah.
If I don't do this anymore,
you were actually just hanging out by the pool, but you brought all your power tools with you.
I can't wait to go take care of my yard when I get back. Yeah. So I have the industrial sized backpack blower, and she wanted to use it, and she's got this strong but smaller frame. And so I said, hey, you want to use this? She says, yes. And she goes, well, what do I do? And I said, well, what do you think you do? How do you think you start it? And she starts pointing at things, and I'm like, nope. So she's looking at it, and she just goes, well, just tell me how to start this thing. And I go, well, if I just tell you how to do it, then you're not looking at it in the same way. If I ask you how you think you might do it, then you're looking at all of the pieces of this blower now, and you're looking at all the components, which she did. She's looking all over, and now she knows. But then the pride when she's like, I do this one? Yes. And then now she knows how to start it, and she's lit up. And so she feels like she knows how to operate that, but came to the conclusion of what to do and looked at all the components of it, which is the basics of life, right? Is how are we asking the people who are bringing us ideas to look at the situation, right? That's what your components do here.
Yeah. And it's the difference between shadowing and being the physician, right? Like, I think we've all had the experience as medical students of you do a whole day of shadowing and you go home and you're like, oh, I'm not really sure what I did today, right? Like, and then when you go through residency and you get to start running the conversation and you get to start making the plans and you're going through that mental exercise of piecing through all of this information and shaping it into something is so satisfying. Obviously, not always, but in terms of feeling like I have accomplished something and I have practiced medicine, that's huge. And so being able to work through a problem yourself and come up with your plan and see it through to implementation, that's such a good feeling.
And to teach it.
Yeah.
You pay so much more close attention when you have to teach something.
Absolutely.
So where do you go from here? I mean, besides literally like back to your room and probably pass out now that your presentation is done, but where does the road lead for you in terms of how you continue to affect change and bring meaning in medicine?
That's a great question. So, I am in my first year of fellowship. So it's, a new department. It's technically just on the hall, but it does feel like a whole new department, right? And so I'm in this process of kind of relearning and asking the questions, right? Of, okay, well, why do we do things this way? Here. And, especially in the ICU, I think that the role of the fellow is like the perfect example of the middle leader, right? You're doing so much teaching and you're teaching procedures that, you've only done maybe 30 of these procedures, but now you're teaching residents how to do it, right? And so you're in this mentor role, but you're also, you have people overseeing you. You have your attendings, you have the charge nurses, you have all of these people who are training you. You're getting a ton of information come at you, right? And you have this really important role and opportunity to say, hey, here's an issue I see. Hey, here's something that I think we can improve upon, but I'm so new here, I need to ask some questions, right? And so I think it's just another opportunity to try and implement this and see, what can I do with this role as a fellow, right? And trying to improve my department, the ICU, and, and all the places that you rotate. And so new role, same principles. Not sure where it's going to go, but, hopefully continuing to kind of try to implement change where I can.
That's great.
Well, if you continue to use what you started with and which is the framework of, taking through these steps, understanding what's going on, the why are they doing it this way? Why is this way?
Yeah.
And not in that kind of why.
Yeah, right. The tone is huge. The tone of the why is huge.
Yeah. It's not what you said, it's how you said it.
Right.
Yeah.
It's a help me understand.
Excuse me, why?
Yeah. What did we hear yesterday? Because that's the way it's always been done.
Exactly.
Yeah. Yeah. The downside of anything.
The tone and if you're checking yourself and are you trying to actually understand, or is it more of a statement?
And people are pretty perceptive. I think people know when you're asking in a real inquisitive way, or you're just asking because you want to complain.
Right. Yeah. Right. I'm going to close out. One of the questions that we always like to finish up with is asking what the patient physician means to you. So that's the name of this podcast. And so you're at where you're at in your career, and what does that statement, that phrase mean to you?
Yeah, that's a great question. I think that it's really impactful in thinking about this role as a physician, right? And it's such a unique job, and you have so much opportunity to help people. Obviously, we all came into this job to help people, to help our colleagues, and to help ourselves, right, understand the things that we're going through. And so I'm so excited about this podcast and this idea that I think is getting more and more traction of, we have to take care of ourselves, right? And that takes investment and time and emotional energy, and we have to take care of each other as a community. And I think it's so great. I'm so excited for this. I'm excited to hear more about your podcast. I'm excited to hear people who know more than I do talk to you about things. Thank you so much for putting this out.
I just want to say thank you for not only for your service. Yeah. I'm very grateful every day for our military service men and women, but also for your perspective on being excited about what you can do. And this idea of leading from the middle, it's just such a position that we talk about, like it's getting squished. So the fact that you're excited about it, that you can impact change from here, I'm excited to see what you get to do, how you continue to lead, and what a great position to be in.
Awesome. Well, thank you.
Thank you so much. Thanks for your service.
No, thank you.
This conversation was brought to you by Physicians Resource Services, a firm supporting medical professionals to improve their financial situation and pursue their personal and professional goals. The Patient Physician is produced in Austin, Texas. Editing and sound design are in the hands of the PodConnects Podcast Network. Please email questions or show ideas to info@physiciansrs.com.